What precautions must parents of children diagnosed with osteogenesis imperfecta take?
Once that diagnosis is made, uh, definitely there is probably a need for some amount of counseling to the family to be careful, to try and keep the child safe from preventable falls, uh, decrease the appetite for risk as far as the child goes. So, for example, if the child uh, is encouraged to participate in contact sports, then the risk of an injury is far higher. That way, by mitigating the risk that the child is exposed to, the risk of the fracture itself can be brought down. So, this is one aspect of management which is not generally speaking a sort of a medical management, but is basically something which is involving the family, involving caregivers, where the appetite for risk can be modified and the risk of the injury itself can be toned down. So, this is one aspect of things. Now, as I said, this most common variety of osteogenesis imperfecta, as the child grows older and older, the tendency for the fractures tends to come down. Okay, this is not a general sort of rule that's applicable to everybody, but it tends to happen that way. And by the time they are young adults, that tendency drops down to the point where they can participate in most routine activities that young adults can do. So may not be contact sports, but definitely they can participate in regular physical activity, attend a job, get to college, participate in sports or activities that are fairly compatible with their uh, health status. So they can get back to more or less normal activities over a period of time. That is a that when that happens, I think that's a great success story for that individual, for that child who's now a young adult, and for the family, and for everybody around that particular child who has facilitated this process to fruition.